Mackenzie, Heathermc, capital K-E-N-Z-I-E. Today I'll be doing a physical examination of my dad. So my mom's going to do a 360 around my apartment, and then we're going to get started.
Go.
Okay, I'm going to start with hand hygiene, and then I'm going to clean my stethoscope with an alcohol wipe. I'm also going to don a pair of clean gloves, and then I'm going to introduce myself to the patient. Here we go. And donning gloves. Hi there, I'm Heather, your daughter. In this capacity, I'm a nursing student with Seneca College. How are you?
I'm very well, thank you.
Excellent. Before we get started, are you comfortable? Do you have to use the facilities?
I'm comfortable and no, I don't.
Okay, perfect. So I'd like to get started with your full name, please.
Colin Mackenzie.
Excellent, Colin. And may I just check your hospital bracelet to confirm? Okay, Colin. So how old are you?
77.
Okay, when is your birthday?
July 27, 1943.
Excellent. Before we go any further, do I have your permission to give you a physical examination?
Yes, you do.
Okay, I've obtained consent and will now provide privacy. Okay, so the patient is a Caucasian male. He's 77 years old with gray white hair. He stands at 5 feet 10 inches tall. For physicality, his fat is evenly distributed for symmetry. His weight is congruent with his height and appropriate. His posture is relaxed while sitting, and he's got no obvious physical deformities. Daddy, hi. Can you tell me who you are?
Colin Mackenzie.
Can you tell me where you are?
My daughter's apartment.
Okay, and can you tell me the date today?
December the 7th, 2020.
Perfect. So the patient is oriented for person, place, and time. His diction is clear and understandable. He maintains eye contact. He appears rested and alert and comfortable and relaxed. So that's great. For cleanliness, he appears well groomed and his clothing is appropriate. Now the work of breathing is good. There is a slight wheezing, but I'll inspect further upon auscultation. At this time, there's no immediate distress, so we're going to get started. So I'd like to start by having you take a few steps towards me. Okay, thank you, Daddy. You can sit back down. Okay, so the patient has a natural gait. There's the presence of symmetrical arm swinging, and he is comfortable in his movements. So I'm going to now inspect and palpate the skull. So upon inspection, the skull is normocephalic. It is the appropriate size for his physicality. There are no obvious scars or lesions. Upon inspection, I'm now going to palpate. Do you feel any pain or tenderness?
Nope.
Okay, patient has no pain or tenderness. I feel no deformities, no lumps. The hair is a healthy texture. It is clean, and there is no signs of infestation. It's a gray white color. Okay, so I'm going to look at your face now. So the structure is midline and symmetrical. There is no involuntary movement of the facial features, and the pallor is good. So I would like you to follow after me and do a couple of facial movements, okay? So this is for cranial nerve 7. So I would like you to lift your eyebrows and down. Okay, the eyebrows are present and they are bilaterally symmetrical. Now can you smile for me? Show your teeth, perfect. Can you squeeze your eyes really tight? Okay, can you frown? Can you puff out your cheeks? Okay, so cranial nerve 7 is good. The patient moves all his facial features symmetrically, so this is a healthy finding. So I'm going to move on to the eyes at this time. So looking at the eyes, do you wear any corrective lenses? Okay, so looking at the eyes, they are neither protruding nor are they sunken. There is no crusting. So I'm going to inspect a little bit further. What I'm going to do is I'm going to pull down your lower lids, have you look up for me, okay? Okay, so the eyes are clear and glossy. The conjunctiva are a healthy pink color, and the sclera is white. Okay, so while we're looking at the eyes, I want to assess for the ocular nerve 3, which is cranial nerve 3. It's the ocular motor nerve. So what I'm going to do is a test called PERLA. So PERLA is an acronym for pupils are equal, round, and reactive to light. So if you look at me, okay, Patient maintains eye contact. Should have done that earlier. So, in measurement, the pupils are 3 millimeters across. Okay, so they are equal and round. Now I'm going to flash a light directly into your eye, okay? Okay, so once the light has been directed, pupils are 1 millimeter and 1 millimeter. So they are equal, round, and reactive to light. I'm now going to do a consensual light reflex test. So in this, I'm going to move the light indirectly into your eye, and I'm going to look at your opposite eye, okay? So, okay, so when the light shines into the left eye, the right pupil constricts, and when I shine the light into the right eye, the left pupil constricts. So the pupils are equal, round, and reactive to light. The next test is for accommodation, because we have symmetrical reactions there. So the accommodation, I'm going to have you look at this pen. Without moving your head, I'd like you to follow the pen with your eyes. Okay, so the patient's eyes converge and focus. This shows accommodation. So perla is good, ocular motor nerve is 3 is intact. So I'm going to move further down now, and we're going to assess the lips at this time. So the lips are pink and symmetrical. There are no lesions. I'm going to inspect a little bit further. So I'm going to grab my light and a tongue depressor, and I'm going to have you open your mouth for me, okay? Okay, so the gums are a healthy pink. There are no lesions, there's no sign of infection. The teeth are all present. They are not loose, and there's 1 gold filling. The tongue itself is a healthy pink color. There are no lesions. Can you lift the tongue to the roof of your mouth? Okay, there is presence of saliva, so the tongue is hydrated. I also want to look at your hard and soft palate. One more time. Okay, hard and soft palate have no lesions. They are intact. Excellent. Okay, so moving on, I would like to assess for cranial nerves 9 and 10. So these are the glossopharyngeal and the vagus nerve respectively. So I'm going to ask you to open your mouth again, and this time I would like you to say ah. Okay, so the uvula moves up and back. So cranial nerves 9 and 10 are intact. Okay, so I'm just going to hand hygiene quick fast, and then I'm going to check for cranial nerve 12, which is the hypoglossal. So for the hypoglossal, what I'd like you to do is stick out your tongue. Okay, tongue is midline. Can you move your tongue from side to side? Okay, patient can effectively move his tongue from side to side. I'd like you to repeat after me. Light, tight, dynamite.
Light, tight, dynamite.
Perfect. So the cranial nerve 12 is intact. There are no tremors. That's perfect. So I'm going to move on at this time. What I'd like to do next is assess the ears. Okay. So on inspection, they are symmetrical. There is no buildup of cerumen. There is no drainage. So I'm going to go ahead and I'm going to palpate. First, starting with the auricle. Do you feel any pain or tenderness?
No.
Okay. Patient feels no pain or tenderness. I'm now going to palpate the tragus. Do you feel any pain or tenderness?
No.
Patient feels no pain or tenderness. I'm going to do something called a whisper test. So I'm going to include 1 ear at a time, then have you repeat words back to me. I'm going to say 3 words, have you repeat them.
I love you.
I love you too.
More than anything.
I concur. The patient repeats the words back concisely, exactly as I said them, so the hearing is intact. So I like to hear. Okay, so we're going to move from the ears to the nose. So the nose is midline and symmetrical. There is no crusting of the nares, so I'm going to palpate. First, I'm going to start with the frontal sinus. So do you feel any pain or pressure?
A little pressure, no pain.
Okay, patient feels a little pressure and no pain. I'm now going to move on to the maxillary sinuses. So I'm going to palpate. Do you feel any pain or pressure?
Again, a little pressure, no pain.
Okay, patient has a little pressure and no pain. Excellent. So now I'm going to move down to the neck. And for the neck accessory muscles are symmetrical. There is no visible masses, and there is no edema, there's no scars or lesions. I'm going to palpate the neck now. Do you feel any pain or tenderness? Okay. Patient feels no pain or tenderness upon palpation. The temperature is normal. There is no enlargement of the thyroid. So the next thing I want to do is I want to check the carotid. So I'm going to do this side to side, 1 at a time. So to start off, 2 fingers. I'm going to count for 60 seconds. There are 60 beats per minute. The rhythm is regular and the grade strength is 2+. Now for the other side, count for 60 seconds. There is 60 beats per minute. The rhythm is regular and the grade strength is 2+. So it's equal bilaterally and healthy and symmetrical. So we're going to move on to the cranial nerve 11. So to test for this, I'm going to put my hands on either side of your head and ask you to move against them. And this is going to test against resistance, okay? Side to side. Okay, and I'm going to do the same thing for your shoulders. I'd like you to flex against my hands. Okay, cranial nerve 11 is intact. So we're going to move on to the upper extremities. So upon inspection, the arms are symmetrical. There is no signs of edema. I see no scars or lesions, and there is no muscular atrophy. I am now going to palpate. Do you feel any pain or tenderness?
No.
Okay. Patient feels no pain or tenderness. The temperature is regular. I feel no masses. There's no heat radiating off of the joints. So we're going to move down from your arms to your hands, if I may. Okay. Looking at the fingers, the nail beds are slightly rounded. I'm going to do a capillary refill test. So I'm going to squeeze your fingers and test to see how long it takes for the blood to return. So go white and red again in 2 seconds. The capillary refill is good. And while I'm here, I'm going to take your radial pulse. So I'm going to take either side and count for 60 seconds. Okay, so there's 60 beats per minute. The rhythm is regular and it's a grade strength of 2+. Now while I have your hands here, I'm going to do a grip test. So I'd like you to take my hand and squeeze. Okay, so the grip is strong and even symmetrical bilaterally. So now that we've got those out of the way, I'd like to do a couple of range of motion, okay? So hands, if you follow after me, we're going to start with flexion, extension, wrist flexion, extension, and radial deviation, ulnar deviation. Okay, so we're going to move to the arms. So flexion, extension, supination, pronation. Okay, and now we're going to move to the arms. Shoulders, just shrug for me. Okay, now we're going to do abduction away from the body, adduction towards the body. We're going to do internal rotation and external rotation. Okay, so I noticed a little bit of slowness to the movements. How did that feel?
A little stiff.
Okay, so the range of motion is slightly hindered by stiffness, okay? So now we've got that out of the way, I'm going to move on to your posterior thorax. If you wouldn't mind lifting the back of your shirt for me, please. Thank you. Okay, so upon inspection, there are no pulsations. The spinal column is straight down. There's no skeletal deformities. Patient is symmetrical, and there's no edema. So I'm now going to palpate. So do you feel any pain or tenderness?
Nope.
Okay, patient feels no pain or tenderness. Temperature is regular. I feel no masses. That's great. And I'm going to do a symmetrical breathing test, okay? So I would like to see if your chest expands symmetrically. So I'm going to put my thumb on either side of your spinal column and ask you to breathe in and out. And again. Okay, as the patient inhales, my thumbs move apart, so the chest expands symmetrically. I'm now going to listen for breath sounds. So there are 9 areas on the posterior thorax to listen for breath sounds. So what I'm going to do is I'm going to move side to side, so from lung to lung and then down. So at each point, when I put my stethoscope on your back, I'd like you to breathe in and out, okay? So 1, in, out. In, out. 2, in, out. In, out. 3, 4, 5, 6, and 7, 8, and 9. Okay, so you put your shirt back down. There is no wheezing or crackles, so the lungs are clear. Unfortunately, I'm going to have to lift your shirt up from the front now because I'd like to do the same for your anteriorly. So for the anterior thorax, there are 5 places I listen for breath sounds. So I'm going to do the same, go from lung to lung and then back down, okay? So breathe in, out, 2, 3, 4, 5. Okay, so So there are 14 breaths per minute. The rhythm is regular and is a good quality. So I'm happy with that. Next, I'd like to check for the anterior posterior transverse ratio. So I'm going to use my hands to measure. So anterior posterior is 1, transverse is 2. So the anterior posterior ratio, transverse ratio is 1 to 2. So now I'm going to listen for heart sounds. Okay, so I'm going to start up at the right sternal border, second intercostal space, and this is where I found the aortic valve. Then I'm going to move to the left sternal border, second intercostal space. This is where I'll find the pulmonic valve. Now the left sternal border, third intercostal space, is where we find the Erb's point. The left sternal border, fifth intercostal space, is the tricuspid valve. And then midclavicular, fifth intercostal space, is the mitral valve. Now that I have the mitral valve, I'm going to listen for your heart, okay? So I'm going to count for 60 seconds. So there's 80 beats per minute. The rhythm is regular and there are no extra heart sounds, so that's great. So it is actually right here between at the apex of the heart, between the tricuspid and the mitral valve, that the S1 sounds are best heard. And as at the base of the heart, between the aortic and the pulmonic valve, that the S2 sounds are best heard. So you can put your shirt down, thank you. So I'm gonna have you move over so I can inspect your lower extremities. Mom, do you wanna come so you can see? All right, so I'm gonna have you lift up your pant leg for me, if you don't mind. Okay, so upon inspection, the legs are symmetrical. There is no involuntary movement. There is no abnormalities at the joints. There's no lesions or scars in evidence. And I'm going to now palpate. Do you feel any pain or pressure?
No.
Patient feels no pain or pressure. Temperature is regular. There's no edema. There's no masses. There's no heat coming from the joints. And they appear good. Okay, so while I'm down here, I would like to palpate for your pulses in your feet, okay? So there are 2. Just so we can see. So I'm gonna check first for the posterior tibialis. So I'm gonna put my fingers here and count for 60 seconds. So there's 60 beats per minute. The rhythm is regular with a grade strength of 2+, so they're equal bilaterally. Now I'm gonna do the dorsal pedis pulse. So 60 seconds. There is 60 beats per minute, and the grade strength is 1+. It's harder to palpate, so it's not as good as we had hoped, but that's okay. So we're gonna move on. I'm gonna check for dorsal flexion and plantar flexion. So dorsal flexion, you're gonna do this with your foot against resistance. Plantar flexion, you're gonna do this against resistance. So show me dorsal flexion. Show me plantar flexion. Perfect. So the feet are equal strength. The pulses are equal bilaterally. The strength is equal bilaterally. So I'm now going to have to ask you to assume the Sims position. So on your back while I perform hand hygiene so that I can look at your abdomen. So if you wouldn't mind lifting your shirt for me, I am going to drape you. So get you nice and comfy. And I'm just going to pull this down a little bit. Apologize for my cold hands. So upon inspection, there are no scars or lesions, no pulsations, the abdomen is symmetrical, the umbilicus is midline, there's no signs of edema, there's no scars or lesions. Okay, so the next thing I'm going to do is I'm going to listen for bowel sounds, okay? So I do this in all 4 quadrants. I'm going to start with your lower right bowel, and then I'm going to move up and clockwise, okay? So, the lower right quadrant, the upper right quadrant, upper left quadrant, lower left quadrant. Okay. So, the bowel sounds are hyperactive. I hear gurgling in all 4 places. So the bowel is nice and healthy. This is a good finding. So the next thing I want to do is palpate. So in the same way I did before, I'm going to palpate from right and around, okay? So, do you feel any pain or tenderness in your right lower quadrant?
No.
Okay, so the patient feels no pain or tenderness. I feel no superficial masses. Moving on to the upper right quadrant, do you feel any pain or tenderness?
No.
Okay, patient feels no pain or tenderness. I feel no superficial masses. Left upper quadrant, do you feel any pain or tenderness?
No.
Okay, patient feels no pain or tenderness. I feel no superficial masses. Left lower quadrant, do you feel any pain or tenderness?
No.
Okay, patient feels no pain or tenderness. I feel no superficial masses. So lastly, I just want to palpate the back bladder. So the bladder is more towards the middle. So I'm just going to palpate around. I'm going to go a little bit deeper. Okay, so the bladder is not distended. The bladder is not typically palpable unless you have retention or distension. So this culminates my physical examination. Thank you very much, Daddy. Thank you, Mom. Thank you.